Welcome back, everybody. Unfortunately, the sounds of this season may be coughs and sneezes. That's because people are dealing with symptoms brought on by the dual wave of cedar allergies and the flu.
Yeah, the experts at Austin Public Health say clinics and hospitals in our area are seeing more patients coming in right now experiencing that flu-like illness. And so here to talk more about what we're facing and hopefully some ways that you can stay healthy is Dr. Desmar Walkes. She is the health authority for Austin and Travis County. Doctor, thanks so much for being here.
Nice to be here. Thank you.
We appreciate it. We know that this is top of mind in our newsroom, and I think so many people
just about
today
everywhere, it
are
seems,
talking
yeah.
about it. So with the flu circulating so widely in our community, what do you want people to know about that illness specifically? How serious is it right now?
The flu can be as simple as a runny nose and a cough, or as serious as somebody requiring hospitalizations, being on a ventilator, and even succumbing to it and dying. So it's something that we can prevent with a vaccination, and it's really important that people get that vaccination.
Yeah, we'll talk to you about vaccines here in just a moment too, but knowing the difference right now between allergies and the flu may be a little difficult. So what should people pay attention to closely to know the difference between those?
It's very difficult to tell the difference between allergy symptoms and other respiratory illnesses. Cough, sore throat, and fever are things that we can see with any number of conditions, so it's really important for you to seek help early so that if treatment is needed for what it is that's causing those symptoms, you can get that in a timely manner.
And what do flu vaccination rates in our area look like right now? And does that play into the amount of flu that we're seeing, that people coming down with that?
Well, right now, our estimate for vaccine protection overall is sitting at about 90% in AISD. However, we know that those are numbers based on what were reported to us last year. Nationally, we're seeing reports of anywhere from 40 to 60% coverage for flu vaccine, and that's low. And so there are people out there who are unvaccinated and unprotected and may get the flu.
I think there's been kind of a feeling or a conversation about some of these folks who do come down with the flu feeling worse than maybe times they've had it in the past. What can you say from an expert perspective about the strain of flu that's going around right now?
So we know that we're seeing H3N2 flu that's circulating, and that can cause symptoms that can make you feel pretty miserable. The vaccine effectiveness is something that we'll know more about at the end of the season when we have all the numbers and crunch those numbers. We can tell from what's happened in the southern hemisphere in Australia that the vaccine effectiveness in that area was about 50% an average. 70 to 75% for kids was flu vaccine effectiveness, and for adults about 50% or so. So it's really important that you do get that shot because it does protect you from severe illness, which is the thing that we want to do. We want to make sure that we're not getting so sick that we end up in the hospital.
And for someone who may not have gotten the vaccine yet and says, okay, it's time for me to be able to do that, is APH providing any flu shot clinics, or what would you like people to know?
APH has flu vaccine available at Shots for Tots and Big Shots, and we have mobile vaccine clinics that we have posted on our website, and flu vaccines available at doctors' clinics and offices, and also at our local pharmacies.
We know that a lot of folks had this maybe over the holidays. If they've already experienced it, but maybe are worried about a long flu season ahead or catching something else, what would you recommend to folks who want to try and ward off a second round of anything hitting them and their family?
There are lots of viruses out there that cause respiratory illness, so if you haven't gotten your flu shot, go get it. And, you know, practice those things that help you protect you. Wash hands, cover coughs and sneezes. Consider a mask if you're in a poorly ventilated area where you may be exposed to people that are sick. And wash frequently touch surfaces and try to avoid touching your hands with your face with unclean hands.
Always good things to remember too, to try to ward off any of the crud that's out there.
Yeah.
But Dr. Desmar Walkes,